Hello YouTube, the norms of the main indicators of a biochemical blood test. A biochemical blood test, BAC, is a laboratory test that is highly informative and allows you to judge the functional status and condition of most internal organs and body systems. As a rule, it is prescribed already at the first stage of detection of various diseases. The norms of biochemical blood tests are clearly defined, within certain ranges, and allow specialists to quickly draw conclusions about the presence or absence of pathologies. Thanks to the study, it is possible to identify problems in the functioning of the kidneys and liver, endocrine and other glands, cardiovascular and other systems. Important. The negative processes that begin in the body can often be indicated by the data of a biochemical blood test, even with slight deviations from the norm. Indications for carrying out BAC can be prescribed for adults and children with periodic or constant pains of various localizations, articular, head, muscle, etc. Respiratory disorders, shortness of breath, cough, bronchospasm. Weakness of the immune system, expressed by prolonged infections. Malfunctions in the digestive system, vomiting, nausea, diarrhea or constipation, belching, etc. Problems in the cardiovascular system, low or high blood pressure, chest pain, rare or rapid heartbeat, sweating, weakness, etc. Kidney problems, changes in the color and smell of urine, urinary retention, pain, cramps, burning, etc. Diagnosis is relevant for dizziness and tremor of the limbs, chronic fatigue, insomnia, infertility, menstrual irregularities, sexual dysfunction, etc. The study is prescribed for weight changes, deterioration of hair and nails, dryness and other skin pathologies, allergic reactions. Deviations of the parameters of a biochemical blood test from the norm in women, men and children are important in assessing the state of health not only by therapists and pediatricians, but also by neurospecialists. The study can be prescribed by a gynecologist or urologist, endocrinologist, andrologist, neurologist, otolaryngologist and other doctors. Deviations from the norm allow making such diagnoses as diabetes, cholelithiasis, rheumatoid arthritis, toxic hepatitis, anemia, acute renal failure, etc. The results of laboratory diagnostics are also important for pregnant women. The study is especially relevant in the first and third trimesters. If necessary, the patient is tested more often. In this case, the results obtained can be compared in dynamics. Perform LHC in newborns. The study allows to identify such dangerous congenital pathologies as cystic fibrosis and phenylketonuria. Assign analysis and older children, as well as adolescents. How to prepare. For the successful conduct of the study, it is necessary to fulfill several conditions for the delivery of a biochemical blood test. In advance, you need to discuss with your doctor the list of medications you take. Some should be abandoned temporarily. 2 days before the diagnosis, the patient needs to adhere to a sparing diet. Fatty, smoked and spicy foods, sweets and alcohol should be excluded. From the middle of the day before the examination, you need to give up strong tea and coffee, as well as other tonic drinks. If the study involves taking an analysis on an empty stomach, it is recommended to stop eating 10–12 hours before blood donation. On the eve of the examination, it is recommended to avoid a contrast shower, sports, visiting saunas and baths, as well as stressful situations. Norms and interpretation of a biochemical blood test. LHC, analysis, the results of which are used to judge a wide range of changes in the work of internal organs and systems. The norms of a biochemical blood test are set according to the age of patients, and also vary depending on their gender and other characteristics. This is important to consider when submitting it and when deciphering the results. In addition, different laboratories use different research methods and units of measurement. In order for the assessment to be objective, you should undergo a second diagnosis in the same laboratory as the first time. Only in this case the comparison of results will be correct. It should also be understood that the level of various substances in the blood can change under the influence of numerous factors. For example, the indicators of total protein are affected by the characteristics of the diet and physical activity of the patient, as well as the functionality of the excretory, digestive and endocrine systems. It is enough to move a little, which will lead to muscle contraction, and the concentration of protein in the plasma will increase. The indicator will change even with a simple change in body position. That is why it is recommended to sit for a few minutes before taking the LHC, and on the eve of the study, do not play sports and avoid physical exertion. Various foods affect the indicators of glial pigments. The main ones include carrots, pumpkin, beets and citrus fruits. The level of potassium and uric acid may increase if you eat a piece of fried fatty meat the evening before the test. Therefore, restrictions are also imposed on the patient's nutrition on the eve of diagnosis. Certain medications can lower lipid levels. For this reason, their reception is stopped at least 7–10 days before the study, after mandatory consultation with the attending physician. The level of uric acid changes when eating kidneys and liver, fish, tea and coffee. Therefore, it is also desirable to exclude them from the diet in advance. Usually, the norms of biochemical blood tests in adults are prescribed in special tables and are used in decoding. The specialist compares the reference values with those obtained. Deciphering the results. How is it carried out? What parameters are evaluated? It should be understood that only a doctor can correctly carry out the procedure. Experts do not focus on the results of one indicator. They evaluate everything as a whole. If any indicator of a biochemical blood test differs from the norm, the specialist pays special attention to it. At the same time, he looks at other parameters. The main important indicators of a biochemical blood test are total protein, various protein fractions, albumins and globulins, glucose, creatinine, urea, sodium and potassium, triglycerides, LDL and HDL, total cholesterol, uric acid, total and direct bilirubin, AST, ALT, CC, AP and GGT. Other indicators are also being investigated. The patient can be prescribed not only a general biochemical blood test, but also a detailed one, with additional indicators. Such a study is carried out if any deviations from the norms are revealed in the LHC, but for some reason the doctor cannot make an accurate diagnosis. Important. The results of a detailed biochemical analysis are examined together with the general one. Otherwise, the diagnosis loses its value. Deciphering a biochemical blood test allows you to draw conclusions about which vitamins, enzymes, hormones, micro and macro elements are in excess or in deficiency. LHC allows you to recognize the pathology of metabolism. Important. All normal indicators of a biochemical blood test are indicated taking into account the age and gender of the patient. This is due to the characteristics of the body of different people. It is necessary to take into account the living conditions, as well as the drugs taken, the already identified pathological processes, including congenital ones, and diseases. Important. You should not try to decipher the results yourself. Most likely, you do not have the necessary knowledge and skills for this. As already noted, the parameters are not evaluated separately. It is important to consider changes in the composition of a holistic clinical picture. For this, in some cases, along with a biochemical blood test, Other laboratory tests and instrumental examinations are also mandatory. Thank you for your time and attention listening to me. Don't forget to hit the like button and subscribe to our channel. You can also click the bell sign to be informed about new videos. Have a great day.